My name is Charlene Margot, and I am the proud co-founder of nonprofit The Parent Venture. We are delighted to have you all with us tonight for an important topic. What should you know? Fentanyl education and harm reduction strategies. Please join me, everyone, in a really warm welcome for Kelsey Moon. Take it away, Kelsey.
All right, so just to give you all a little bit of background in who ACS is, we have been providing services to the Bay Area since 1975, primarily in San Mateo and Santa Clara counties. We have expanded beyond there a bit in recent years. We work with youth who are 11 to 25 years old to develop leadership, engage in youth-focused research, shape and change communities at the policy level, while also providing essential needed counseling services. We are a nonprofit that is largely donor and grant funded. As Charlene mentioned, I am the director of the Adolescent Substance and Addiction Treatment Program, which has been around since 1991. We also have a few other programs, including some alternative to suspension programs, largely part of our ASAT team, community counseling services, on-campus counseling, which is provided through local schools in the region, and our outlet program, which is our LGBTQIA+ SOG services. So I wanted to take a moment just to talk about opioids, since fentanyl is an opioid, a synthetic opioid. So the way that opioids work is they activate our opioid and dopamine and GABA receptors in the brain. And in doing so, it blocks our pain and it creates a feeling of euphoria. Other acute effects beyond euphoria include sedation, sometimes feelings of nausea, feelings of tranquility, but it can have negative effects, including leading to overdose and death. Chronic effects of opioid use can include negative effects to the liver or liver disease, potential for brain damage. This could include overdose, in extended oxygen deprivation to the brain. So multiple issues that can be related to that, mood changes or aggression. Different types of opioids, and it can include fentanyl, which is what we'll be focusing on tonight, heroin, oxycodone, morphine, hydrocodone, codeine. These are all different types of opioids with similar and varying degrees of effects. So tonight we're focusing on fentanyl. And I'm sure you've all heard about fentanyl. It's been in the news a lot lately. There's an epidemic going on nationwide right now. Fentanyl is a synthetic opioid. It is 50 times stronger than heroin and 100 times stronger than morphine. The main purpose of fentanyl is for people who are in pretty excruciating pain, be this surgery, accidents, cancer. There are uses for fentanyl that are medical. It is used in medical facilities for instances of extreme pain, and it is also being found very widely illicitly, and that's kind of what I'm focusing on today, is the more illicit findings of fentanyl within our community. It can be found in a variety of forms that include powder, liquid, and pills, and the most recent stat we have is that over 150 people nationwide died daily from synthetic opioid-related overdoses, including fentanyl, also carfentanyl, which I'll be touching on. But a lot of these deaths are related to fentanyl, and so it's a really important topic for us to be spreading awareness of. I wanted to touch on carfentanyl. It's much less commonly seen than fentanyl, but it has been found in illicit substances, and so I think it's worth talking about. It's also a synthetic opioid. It's 10,000 times more potent than morphine and 100 times more potent than fentanyl. And given how potent fentanyl is that we've just been talking about, that's really noteworthy. The purpose of carfentanyl is primarily it's used as a tranquilizing agent for large mammals. So think elephants, mooses, large zoo animals. And so if you imagine a substance that can put out an elephant, can have a really devastating effect on humans. It doesn't take very much. And so, as I mentioned, even though we're not seeing this in substances the way we are fentanyl, it has been found in some illicit substances. And so it's worth just knowing, I think, what it is and a little information about it. Carfentanyl can be found in several forms. It can be found in powder, tablets, patches, sprays. I don't know if any of you have heard of some of the news stories of first responders absorbing substances through their skin or having overdoses from inhaling things. This is actually more likely to be carfentanyl than fentanyl, because it is in so many wide different forms, and it's so potent that actually touching it and absorbing it through the skin or inhaling it, if there's the substance floating in the air, is really dangerous. And so if you do hear of those stories, those are the stories that are actually more likely to be this substance carfentanyl. Carfentanyl is it's not being found so often intentionally put in substances, but it's floating around out there. It's being passed around, and so and it is a dangerous substance. So this is, I think, a good visual just to see how potent these substances really are. A fatal dose of fentanyl for the average adult human is 2 milligrams. And so as you can see, compared to Lincoln's head on a penny, it's smaller than Lincoln's head on a penny. It doesn't take very much. And this is why it's such a popular substance for drug dealers to be putting in illicit substances. It's cheap because it's so potent. It doesn't take very much. And it produces a really intoxifying effect. So it's, in all intents and purposes, as far as drug dealers are concerned, it's very effective. And carfentanyl, and this is really an alarming visual, it takes a very, very small dose to be lethal to humans. And I'll just repeat, this isn't meant to scare anyone. This is carfentanyl we're not seeing very often in illicit substances, but it just shows, in comparison to fentanyl, which is so much more potent than heroin, just how potent this substance is. I know Marco mentioned earlier that we've seen colorful fentanyl. It's being seen in a lot of different substances. I have some visuals here, and I also just wanted to talk a little bit about fentanyl-laced substances. So in addition to being used independently, there are individuals who are buying and intentionally using fentanyl. It's also being mixed within a lot of illicit substances, or laced, as we would call it. And this means that people are buying these substances in the street and they don't know that it has fentanyl in it. We're finding it in heroin. We're finding it in benzos, such as Xanax, for example. It's being found in cocaine, in Molly or MDMA or ecstasy. There's a variety of names for that substance. It's being found in ketamine. It's even being found in meth, which is an interesting one because fentanyl is such an extreme downer and meth is such an extreme upper, but it's just a cheap additive. So it's being found in a lot of these different street substances. I think it's worth noting that even pills that look like prescription pills, or that we expect to be prescription pills, if they're bought on the street, might be laced with fentanyl. I have another slide to talk a little more about that and give a visual of what that might look like. But, you know, when I work with teens, I always tell them, if you're going to buy or accept a substance from a friend, it's really important to know where that substance came from, because something could look very standard prescription and still be laced with fentanyl if we don't know where exactly it came from. Even black market THC wax cartridges, so this would be like marijuana vape cartridges, have been found laced with fentanyl recently. You know, it's wild. I would have never, in fact, I still as an adult don't know how to use the black market, but teens are so good with technology and they're figuring it out. And so anything that is ordered online that really shouldn't be ordered online, as far as substances go, there should at least be, you know, an expectation that there might be some fentanyl in it, because that's just what we've been seeing. So here's a visual to give you an idea. Individuals who are creating these street pills are getting their hands on some really good pill pressers that look very similar to the pill pressers that are used for prescription pills. So as you can see on the left here, we have an authentic oxycodone or oxy tablet from a pharmacy, achieved by prescription, versus one that it was achieved on the street, that was containing fentanyl. Similarly for Xanax, similarly for Adderall. And for Adderall, it's a little different because they're different strengths. So the pills look very slightly different, but this just gives you an idea of how good the fakes can look. And so even if a pill looks like a legitimate pill, if it wasn't obtained directly from a pharmacy, there's no way to expect that it was a legitimate pill today. There's just too many good pill pressers out there. And so again, this is something I always talk about with teens of like, make sure you know exactly where things come from, or be vigilant, be testing them. And I'll talk more about testing as we get into the harm reduction. So I wanted to talk a little bit about opioid intoxication and what that might look like. So someone who is under the influence of opioids might have small or restricted, or what we would call pinpoint pupils. And when I say small pupils, if we're out in bright lighting, we're in a bright room, we're out in sunlight, it's normal for our pupils to be small. In this sense, I would mean so tiny you can barely see them, or in a darker lighting, not large enough that it would look normal. So in other words, more restricted or smaller than what is normal for whatever lighting that you're in. These are going to be like noticeably small pupils. Extreme sleepiness or inability to stay awake. I don't know if any of you are familiar with the nod or the heroin nod. And this is kind of like you're in the middle of a conversation with someone and they're unable to keep consciousness while talking. They're kind of like falling asleep in an abnormal way while having a conversation. Slowed breathing. So because opioids are a depressant, it slows down the breathing. And this is going to be noticeably slowed breathing, like breathing slower than what seems safe or normal. Altered mental state. Sorry, I just realized I have a typo here. Mental state, not mental state. So this is going to be decreased awareness or responsiveness, maybe confusion or even delirium. So the mental state is off of what seems normal. And then, as I mentioned earlier, nausea or even vomiting is very common with opioid intoxication. It has a tendency to have a side effect of nausea. And if you're under the influence of enough opioids to be like fully high or intoxicated, that nausea tends to get a little more profound. So I also wanted to touch on some signs of overdose from opiates specifically. So as I mentioned, breathing tends to be slower when it comes to opioids. This can also lead to decreased oxygen inhalation, and even oxygen without the body doesn't tend to be like circulated as well as it should be when under the intense influence or too much influence to the point of overdose from opioids. And so what we tend to see is discolored skin, especially in the lips and nail zone, specifically blue. If you're seeing blue lips, blue nails, that's a sign that the body is not receiving enough oxygen, might be a sign of an overdose. Really cold or clammy skin. And again, that's a sign that blood circulation, oxygen is not circulating well. Limp body, so thinking, unable to wake someone, shaking them, not able to stir them. A slowed breathing, very slowed, weak breathing, or a lack of breathing, or choking and gurgling sounds. And so especially if someone's on their back, sometimes that nausea that I mentioned can happen even if someone's losing consciousness. And if they're on their back and they're trying to vomit, they can asphyxiate. So you might hear some choking or gurgling. They might be asphyxiating. If you hear that, it's really important to turn them on their side. And I'll touch more on that later. And I want to just note again that I don't bring up these signs to scare anyone. I think it's really important to know because as much as we hope we never see a friend or family member, experience this, I personally live in San Francisco. And so if I walk downtown, you never know what you're going to see. And I think it's become such an epidemic that it's important to know the signs, to know what we can do, and just to be able to recognize in case we are ever in a position with someone we know experiencing an overdose, to be able to recognize it and to know maybe what we can do to mitigate it. So I took this directly from the California's CDC kind of guidelines, and also there's the same guidelines on the first responders site of the best ways to respond in the case of someone overdosing on opioids. The first step, and I'll talk more about Narcan, I'll get into that more extensively in a bit, but if you do have Narcan on hand, that's the first step to administer Narcan. Very easy to do. And then secondly, or better yet, if you have someone else there simultaneously, if one person can be giving Narcan while another person calls 911, that's ideal. But the second step, if it's just you, is to call 911. And it's really important to note that this step, and I'll touch more on this later on, but the step is crucial even if you did give Narcan. Narcan is not a be-all end-all solution. So it's really important to call emergency services or to get someone to an emergency room, even if Narcan has been administered. Keep the individual as awake and breathing as well as you're able. I mean, for obvious reasons, but you know, if you can just keep them conscious until first responders arrive, that's ideal. If somebody is losing consciousness, and I mentioned this before, it's best to lay them on their side actually, rather than their back. And this prevents asphyxiation, the risk of asphyxiation. And if they do have a need to vomit, the body can involuntarily vomit if it's on its side, but not necessarily if it's on its back. And then just stay until first responders arrive, which I think seems obvious if it's someone that you know, but even if it's in a situation with a stranger, someone can seem rather fine, especially after they've been Narcan for a moment, and then not be so fine the next. So just staying until first responders arrive and can take over is a last step. All right, so I've poured out a lot of information, probably some of it pretty scary about opioids. And the reality is we live in a scary time for illicit substance use because fentanyl has really appeared so much on the scene, has made its way into so many substances. And the other reality is that there is a fair amount of substance use that is really normative. I mean, there are a lot of adults within this country, and I won't even get into cannabis. It's so different in every state. There are a fair amount of adults nationally, I mean worldwide, but just keeping it within this country, who have a healthy relationship with alcohol and can engage in use of alcohol without overdoing it, without putting themselves in danger, without making themselves unhealthy. And so I think substance use has been part of human life for pretty much always. And ideally, it'd be great if we can teach our youth to build a healthy relationship with substances, and be able to recognize when that relationship becomes unhealthy, and to know what to do when it becomes unhealthy. And so ACS, we operate from a position of harm reduction, which means the CDC actually describes harm reduction as a public health approach that focuses on mitigating the harmful consequences of drug use, including transmission of infectious diseases and prevention of overdose, through provision of care that is intended to be free of stigma and centered on the needs of people who use drugs. My definition of harm reduction would just be that not everyone needs abstinence. Abstinence also just doesn't work for everyone. Not everyone feels like abstinence is the course for them. And so harm reduction offers an alternative method to reduce harm and danger of substances without necessarily needing abstinence. Although abstinence is within the umbrella of harm reduction, and I'll touch on that again in a bit. But it offers us a wider umbrella of options of how to keep folks as safe as possible while meeting them wherever they're at and meeting them where their needs are. So with that, I'm going to talk a little bit more about what harm reduction looks like in general. So harm reduction has 8 general principles. The first principle is that harm reduction accepts that substance use is part of the world that we live in. I touched on that. Some of that is normative. There's definitely a point, excuse me, as which it becomes unnormative. substance use chooses to work to reduce substance use's harmful effects rather than condemn or ignore them. We learned that just say no didn't work. Choosing to just condemn or ignore the harmful effects of substance use doesn't necessarily work. So harm reduction accepts that this is a reality and chooses to work with that to keep folks as safe as possible. Harm reduction also understands, number 2, that substance use is a complex and multifaceted phenomenon that encompasses a spectrum of behaviors. As I mentioned, this ranges from complete abstinence to severe scary use, and acknowledges that there are certain ways of using substances that are safer than others. So this kind of goes back to what I mentioned with that there are a lot of adults that live within our country that that have a healthy relationship with alcohol. They choose to use alcohol and they don't find that they are having a lot of negative consequences from it, or that it is impacting them in a negative way. And so we look at this as a spectrum, and that folks can be on either end or anywhere in the middle, and that there are certain ways of using substances that are more harmful than others, and there are certain ways of using substances that are safer than others. And folks might fall somewhere in the middle and not quite be ready to end up in where we wish they would end up. But sometimes the best we can hope for is to get them to move down the spectrum away from where they're at in the harmful region of consequences. So we also recognize from a harm reduction perspective that we can establish well-being and quality of life without necessarily needing cessation of all substance use. So this can be the criteria for successful policies and interventions regarding substance use, and not necessarily complete abstinence in order to live a well-balanced and quality life. Number 4, harm reduction calls for non-coercive and non-judgmental provision of resources and services to substance users and their communities to help minimize attendant harm. So in other words, again, touching on the just say no didn't really work. We've noticed that judgmental and coercive provision of resources don't really work. They don't really reduce harmful substance use. So this is the idea that using non-judgmental provisions and not trying to force abstinence or complete cessation can actually help to minimize harm. Coming at substance use from this harm reduction perspective can actually reduce harm better than this idea of just say no, just abstain. For those who are in that place of not wanting to fully abstain. The 5th principle of harm reduction ensures that individuals who use substances or with a substance use history have a voice in creating policies and programs designed to serve their needs. I think this is another really important one because if individuals who have never had a substance use history or who have never chosen to engage in substance use are the only ones who are creating these programs and policies, we, even those of us with an educational background, we don't have the same kind of knowledge base as those who have experienced what it's like to be struggling with substance use issues. And so for those who have a history with substance use and or are going through substance use treatment, for example, to have a say in what has worked for them, what hasn't worked for them, what might work for others, I think that's really important. And that's really what's helped us within the harm reduction standpoint to get to where we are now of making sure those individuals have a voice. The 6th principle is affirming that substance users as primary agents of reducing the harm of their own use, and also empowering them to support one another and share information. And I think, since the creation of Alcoholics Anonymous, Narcotics Anonymous, original 12-step, we have so many of these community resources. It's just that industry has really expanded. And so I think that's a great example, because having the support of someone who understands more or less what you're going through makes such a difference. And so empowering those who have overcome their own struggles to help others who have similar struggles is, I think, a great part of harm reduction, and also a great way to get the information out there of like what has worked for other people, what might work for you. Number 7, recognizing that the realities of social inequities do affect both vulnerability and the ability to effectively deal with substance-related harm is important. And so our data shows that there are statistically more liquor stores and cannabis dispensaries in low socioeconomic status, low-income neighborhoods compared to higher-income neighborhoods. So keeping something like that in mind. Also keeping in mind that those who don't have insurance or don't have a good insurance might struggle more to achieve resources when it comes to substance use treatment. For example, the programs, especially those that are residential or inpatient, that are designed to be for individuals on Medicaid, Medicare without insurance, have so much longer wait lists typically. And to pay out of pocket, it's extremely expensive. So just keeping in mind that there are definitely, there's definitely this reality that social inequities affect individuals' vulnerability to selecting this as a coping mechanism versus other potentially negative or harmful coping mechanisms, but selecting substance use specifically as a coping mechanism, and also to be able to access care or effectively deal with substance use struggles is a reality. And it's something that I think the more we recognize and accept, the more we can work to mitigate those challenges. And then finally, number 8, the harm reduction principles say that we do not attempt to ignore or minimize the tragic and real danger or harm that can be associated with substance use. So I've thrown out a lot there that say, like, you know, we accept people where they're at, we meet them where they're at, and we don't ignore or try to minimize that substance use is very much can be dangerous, it can be harmful, and it can be tragic. And that is also a reality. So I'm going to talk about some harm reduction strategies. The first is education, and Marco mentioned that. And I think just being here today, that in and of itself is a harm reduction strategy. Educating ourselves, educating our teens, educating our school systems, educating our communities. As much education as we can get out there is so helpful, because, you know, just having the knowledge that we need to be testing substances, that we should be wary of pills that maybe look like they're directly from a pharmacy, that fentanyl is a big risk that's out there, that we might be able to trust our friends, but we can't necessarily trust wherever our friends are getting things from. All of this knowledge is in and of itself a harm reduction strategy to just make more informed choices, make more educated decisions. And so that first and foremost, I think is huge. I don't have a slide for that one because I think that one's pretty self-explanatory, but I wanted to just explain what I meant by having education on there. And then the rest, I have slides to get a little bit deeper into here, but I want to talk a little bit about safe injection sites and needle exchange programs, largely because I think that while it might not affect youth as much, it is what a lot of people think about when they think of harm reduction. It's kind of where harm reduction originated. So I think it's worth just touching on and noting what that is. I want to talk a little bit about drug checking, meaning like testing kits and strips, medication-assisted treatment for individuals specifically addicted to opioids and or alcohol, but mostly I'm touching on opioids here. And then also, I mentioned that we'll get into Narcan, and that's what I'm talking about when I talk about overdose prevention and reversal. So to start on needle exchange programs and safe injection sites. So for the needle exchange programs are for intravenous or IV drug users. These are programs in which they can exchange used or dirty needles for clean, sterile, unused needles. And this is intended to prevent the spread of diseases. So this prevents the spread of hepatitis, of HIV, of things that are known to be spread by dirty needles. And I will note in the middle here that the idea of both of these harm reduction strategies is that these are things that are happening anyway. Taking away needle exchange programs doesn't mean that people aren't going to use needles for drugs. It just means they'll use dirty needles instead of clean needles. So the idea is if they're going to be using needles for drugs anyway, at least this way, they're hopefully reducing the spread of disease. Similarly, for safe injection sites, these are sites in which medical personnel are on staff actually to monitor individuals who show up to use IV drugs. And so again, this is the idea that these are individuals who are already going to be injecting drugs. And if they're going to do that, a lot of the overdoses that happen that are not reversed, many of them happen because there's no one on site who is in a sober, level-headed position to be able to prevent or reverse that, or there's no Narcan on hand. You know, these things aren't available. And so this is the idea that if someone's going to be using IV drugs, at least there's someone who can hopefully prevent overdose, or if it does happen, be on hand to administer Narcan, call 911 before the overdose gets non-reversible. So testing strips and kits, fentanyl testing strips are getting pretty popular. They're easily available online, like think Amazon. They're not expensive. And actually, if you go into some bars within the city, I don't actually know outside of San Francisco. I apologize, I didn't add the site here. I don't have it. I don't have it on hand, but there's a site that I had found when I was researching this that shows you around San Francisco and Oakland, the bars that actually offer free fentanyl test strips. So there are some bars where you can even walk in and ask and they'll give you one or two. But they are pretty inexpensive to order and are as easy to find as Amazon. And what you do is you essentially dissolve said substance, or there's different ways to do it based on the substance. There's like directions, and use the strip almost similarly to like a urine analysis for like a urine or other kind of testing strip. And it'll appear with, I think most of them are, I can't remember if it's 2 strips for fentanyl, 1 strip for non, or vice versa, but it almost looks kind of like some of the COVID strips did, where you either have 1 line or 2, and it'll tell you if there's fentanyl in a substance. What's worth noting about these, and what I really stress to teens when I talk about these test strips, is these fentanyl test strips only confirm or deny the presence of fentanyl. It doesn't say how much fentanyl is in there. Ideally, if it tests positive, you just throw the substance out, right? And like that's the ideal like circumstance for someone who finds out their substance has fentanyl in it. But if someone does choose to use a substance anyway, there's no way to know by those strips how much fentanyl is in the substance. It also, and I stress this to teens as well, does not talk about, or doesn't mention or reveal if there are any other harmful substances. So for substances that are known for having a lot of different things in them, like cocaine, MDMA, Molly, ecstasy, heroin, meth, there's no way to know what else might have been mixed in that's harmful. All it reveals is whether or not there's fentanyl specifically in there. There are more expansive drug testing kits that can also be accessed pretty easily online, but are more expensive, vary in price, will test for many more substances. You can get kind of an expansive option from anywhere from, you know, just a couple of different things to like almost telling you exactly what's in what you're testing. And so they are out there, they're available. It just depends on how much money someone wants to spend on this and how important they think it is to test what all might be in there. An example of this might be for a parent, if you find that your child has pills that they access from a friend, and you're just curious if the pills have fentanyl in them, or if they're like direct pharmacy. Fentanyl test strips are a good option for something like that, for example, because it'll tell you if there's actually fentanyl within the substance. For some street drugs, it'll tell you this, if there's fentanyl, which is the leading cause of overdose, but doesn't have necessarily information about other things. So medication-assisted treatment primarily relates to, this is mostly for people who are interested in stopping opioid use. So for folks who have been addicted to opioids or who have developed a dependence, there are a number of medications that can help both mitigate the withdrawals and also help with the urges that tend to come from trying to stop opioid use. I'll start with methadone, actually, because methadone is a kind of an antiquated medicine. It's still prescribed, it's still used, but it is not as commonly prescribed. And the reason being, there's 3 different types of these medication-assisted treatment options in terms of how they affect the brain. So if you look at this upper right-hand corner picture that I have, there's a picture of what an opioid receptor looks like. So methadone, if you ever talk to someone who is on methadone, they will say it almost makes them, quote unquote, a little high. They get a little bit of that high feeling. And the reason is because methadone is a full agonist. It fills that opioid receptor. It is a low dose opioid. And so it feels like a low dose opioid. It's not a heavy enough opioid to cause an overdose. Folks that are prescribed it, often the addiction is severe enough, or it is affecting them in such a way that that's what they need. And so it mitigates urges because they're getting the effects enough that they're not still craving opioids. But it does fill that opioid receptor because it is a low dose opioid. And often for methadone clinics, folks have to go every day to get their prescription just to make sure that it's not being abused. So the next is buprenorphine. Sorry, I can hardly ever say this correctly. Buprenorphine. So this is most often recently seen in the form of Suboxone, but buprenorphine is a partial agonist. So it's going to stimulate that opioid receptor just enough that you get almost a mild sensation of opioid, but not really. You're not going to feel any sense of high. It just is enough to reduce the urge of needing it. It's going to reduce the withdrawal effects. Most often in our modern day, what we see in this buprenorphine is in the form of Suboxone, which is actually a mix of buprenorphine and naltrexone. And what that does is naltrexone is an antagonist, which means instead of stimulating that opioid receptor, it blocks it. So nothing can get through. So if you take naltrexone and you take an opioid, you won't get high. And that also, it's actually prescribed for individuals that are struggling with alcohol addiction as well, because alcohol also affects the opioid receptors. You won't get that feeling of being high or drunk if you have naltrexone or an antagonist blocking these receptors. And so what Suboxone is it's a combination of buprenorphine and naltrexone. So it stimulates the opioid receptor just enough to keep the individual from feeling withdrawal, but also blocks their ability to get high. So if someone has taken Suboxone, they know that even if they go try to get high, they're not going to experience a high. And that actually helps a lot with urges. The trick is for these individuals is that they have to make sure they take their Suboxone every day. Otherwise, they could get high still. So, but it's a really effective medication and that is great for use long-term in mitigating those urges and withdrawals when trying to deal with opioid addiction. So now I want to talk about Narcan. Narcan is, it's also an antagonist, and when administered, well, first of all, the generic name is naloxone. So if you see naloxone, it is the same thing as Narcan. It's just the generic. It's very safe. In other words, if you were to administer Narcan to someone who is not on opioids, they would have no effect from it at all whatsoever. The only time it affects you is if you have opioids in your system, and it will block the opioid receptors. What it essentially does is put someone under the influence of opioids into immediate withdrawal. And I mention that because if you were to Narcan someone, they probably aren't going to be super thrilled right at first. Not to say they won't appreciate it maybe later, but people tend to get agitated because it puts them into immediate withdrawal. It does stop an overdose temporarily, which I'll get to. It's really easy to use. On the box, it'll say lay, which means like lay someone back, make sure they're safe or in a prop position. It can be used sitting up, but this is just, if someone's losing consciousness, to make sure they're safe. Spray it in one nostril. You don't even have to plug the other nostril. And then stay, as I mentioned earlier, stay until medical personnel come. I have a video showing how to use it, but it's as simple as that. It works really quickly. You'll see individuals start to come out of overdose within seconds. It's a short-term solution. So what a lot of people don't realize about Narcan is if you Narcan somebody and they regain consciousness and they're, talking, walking, they're not just good to go. It's a short-term solution. So Narcan, in about 30 minutes, typically it'll wear out of the system and they can go back into overdose. So you still need to get them to a hospital. They still need emergency medical care, but it is a short-term solution that will keep them from dying of overdose in that meantime. Another important thing to know about Narcan is that it is because of fentanyl, since fentanyl and especially Carfentanyl hit the scene, sometimes one dose is not enough. So if you Narcan somebody and, 10 seconds or so has passed and you're not seeing, especially if you hit 20 seconds, you're not seeing any stir at all, sometimes you need to administer another dose in the other nostril. I have a quick video here just to show how to administer it.
Allison, a pharmacist, and today I'd like to go over how to use your naloxone product. It can be really difficult in an emergency situation to remember everything that you may have learned about naloxone. So feel free to come back to this video from time to time to review the information here so that you can always be prepared in the event that you witness an opioid overdose. So you've called 911 and grabbed your naloxone. Now what? This is Narcan nasal spray. It comes in a box with 2 doses. You're going to take 1 dose out of the box, remove it from the packaging, and the applicator goes in 1 nostril, and you're going to depress the plunger with a quick, firm push. When putting in the applicator, you'll want to form a tight seal at the patient's nose so that the medication goes up into the sinuses and does not come down the face. And then with a quick, firm push, you're going to administer the medication. There's no need to depress the other nostril. You can leave it open. And if a second dose is needed, you will apply it in the other nostril than the one that the first dose was given in. And that's how you use the Narcan nasal spray. Hi, I'm Al.
Oh, there we go. All right. So as she mentioned, it can be used sitting up, but you just insert in 1 nostril, push the plunger, and if you suspect that someone is overdosing on an opioid and you administer Narcan and they actually weren't under the influence of opioids, it will not harm them. Nothing will happen. So it is extremely safe. I wanted to just mention where Narcan or naloxone can be accessed. So at Adolescent Counseling Services, we have an office on Woodside in Redwood City. We are an official distribution site. We distribute them for free. So you can come into our office at any time and just ask, and we can give you some Narcan for free. I think it's really fantastic to have on hand. As I mentioned, none of us ever want to think that our child or our family member is going to need it. But what about our family members' friends or our children's friends? And I think it's just one of those things that's honestly better to have on hand than not. I think of it almost like a fire extinguisher. I hope that I never have to use the fire extinguisher under my sink, but I'd rather have one there than not have it. It's also recently available over the counter. I don't know how insurance works for this. I actually haven't looked into it. The price does vary for over the counter, but you can walk into a pharmacy and buy it over the counter. And then there are also online organizations such as nextdistro.org/CAchoice. And these are specifically designed for individuals who are at elevated risk due to using opioids themselves, having an opioid user in the house, and that includes if you have a family member in the house who is prescribed opioid pain medication and it just makes you feel better to have it in the house. I actually was just curious how this site, Next Distro, worked. So I went online and filled it out myself. And what it told me was they'll either send Narcan to my house or they will mail me a letter that lets me know where I can show up in person to request some for free. So that is another option. And it might give you either option. They might just ship it to you, or they might tell you areas that are close to you where you can pick it up. But if you want a guaranteed place, you can get it for free. You can come into our office. We have a label that we printed to put on it with a QR code that'll show you a video. So if you want an easy way to go through a video such as the one I just showed you, it'll be readily available as well. All right, and then I want to invite, I'm going to stop sharing and invite Charlene back online to help us field some questions. Thank you all for listening.
Thank you so much, Kelsey. That was a lot. That was a lot. I'm glad my kids are young adults. I'm a little bit past this phase. What are you seeing in the kids that you work with? Are they as frightened of fentanyl overdose as we adults are?
They are frightened, and I think education is such a big need for the teens because they're frightened and they also don't know. They're confused and they don't know what this means. Like, they don't necessarily know that if a friend hands them a Xanax in class, that it might not actually be a Xanax that came from a pharmacy. And they tend to be just as shocked and frightened by that news as the adults that I've worked with.
It was pretty disturbing to see how good the pill pressing has become.
Yeah, it really is. I don't know where these street folks are getting these professional pill pressers, but in fact, sometimes they even look more perfect when they're street pills because they haven't gone through, the tumbling packaging that, the professional pills have for so long. But you really just can't tell by looking anymore.
So just so we are clear, is zero fentanyl the goal here? Like, if you get a pill and your friend hands it to you, or you buy it on TikTok, or I don't even know how you do that, but I know that they do. Should you assume that if you test it and there's anything found, you need to get rid of it? Is the idea that we should not be ingesting any fentanyl in a substance? What's your take on that?
That's what I tell teens. And sometimes I'll have them tell me, well, I've taken a couple of these pills already and it was fine. And I'll say, yeah, and that's really lucky. And also, if you were a drug dealer, would you carefully measure how much went into every bit, or would you just dump some in? You can't guarantee that one pill is going to have the same amount as the one prior. So yeah, if I saw any fentanyl in something, I would say the safe bet is to dump it and not chance it.
All right. And so in terms of those test strips, if you have a pill, what do you do? Do you have to crush it? Do you have to dissolve it? That means you waste that, whatever you bought, right?
So each kit is going to be a little bit different. I've looked at a few of them. Generally, it seems like the directions are you file off a tiny bit, like an itty bitty portion, almost nothing off of the pill, and dissolve it in water and put the test kit in. So I think they intentionally do that for the strips so that folks don't feel like they're wasting their product in order to test it. It's a very, very small amount that's needed.
But if the fentanyl's in a different part of the pill, then you don't really know anything, do you?
So I should have clarified. So yeah, so if it's a powder substance, you shake it really well. It's a little bit. For pills, one of the things that I am teaching teens is that if a drug dealer ever sells you a pill and says, don't worry, it's already been tested, it's fentanyl free, you can't believe that, because you have to actually crush the pill, mix it around so that you're getting a good test of it. Yeah, you can't just trust one area of the pill. It actually has to be crushed. So if you get a pill and it's still in press form, it has not been tested for fentanyl.
All right. And Kelsey, what do you say to the opponents of harm reduction strategies like the safe injection sites, like needle exchanges? Some people say that stocking Narcan is just an invitation for kids to do drugs. How do you respond to that?
I think I understand how scary it is. to know that these exist, to know that this is a place that someone that you care about could end up. And we've learned, I think over the years, we've learned that not having them exist doesn't mean that the problems go away. They just happen less safely. You know, I think of it similarly to the importance of like sex education. Taking away sex education doesn't mean that sex in teens doesn't happen. It just means it's less likely to happen safely.
Yeah. Are you finding that teens are raising some of their own safety protocols? I know like the kids figured out to have designated drivers, and they're pretty good about that if they're at a party where alcohol is being served. Is there any kind of corollary for drugs like this?
You know, we've started talking about these harm reduction strategies in our teen groups, and we've actually had teens come to us and say, where can I get fentanyl strips, and be actively looking for them. And I think that when teens realize what these risks are, it's not that they're willing to just say like, oh, you know, I'll just chance it necessarily. They want to protect themselves if they can, but sometimes they want to protect themselves and still use drugs. And so if they have ways to mitigate the biggest risks and they're not difficult to find, I find that they're trying to use them.
Okay, that's really good to know. So, Kelsey, we've about come to the end of our hour together. Thank you. This has been incredibly informative. Thank you to everybody who stayed on with us and has really said thanks for all this information. What kind of closing advice do you have for the parents and caregivers and educators who are on with us tonight?
I would say my closing advice is if you can have these conversations with your teens as non-judgmentally as possible, you know, letting them know that you want them to be safe and you want them to be healthy, and you know that they can come to you if they have these questions. I think it makes a huge difference. And the teens often will take advantage of that. They will ask the important questions. They will bring up the important topics if they feel like it's not going to be punitive in the way that it's approached.
That is really great advice. And see, all the little floating hearts prove that. You know, the purpose of this organization that I started 18 years ago was to give parents the education to communicate with their kids. And I used to say, your homework tonight is to go in, go home, tell your kid one thing that you learned that night. So again, parents, I think that's still great homework. I hope that you'll talk to some of the young people in your life about what we heard from Kelsey Moon today. And a huge thank you to you, Kelsey, and ACS for tonight's presentation. Take care, everybody. Happy holidays. Hope to see you again soon. Thanks for coming.